So in today's topic, it's nutritional and food requirements for adolescents. Those who have the textbook, page number 125. If you have a new textbook, recent edition, you can mention the page number in the chat box. So if anybody is joining late, please help them out with the topic name. So good nutrition is essential for teenager because that is also a developmental age. Okay. But when a child is transitioning into an adult, teenage is that phase of time of the in a child's life when they're transitioning into adults. Okay. So for growth and development, good nutrition is also important during this time. Almost around 1,400 or 2,800 kilocalories are required, depending on the activity level and gender of the child. Okay. Girls require much less calories as compared to boys. Okay. This number varies as different numbers of exercise and metabolism. They are different between adolescents. Okay. Those who are involved in physical activities, extracurricular activities, which are more physical and sporty in nature, they would require more calories. Okay. So depending on the energy expenditure of a child, of a teenager, calorie intake will also differ. So usually the food guide that we provide during adolescence or teenage have a lot of vegetables and fruits, whole grains, whole cereals, legumes, beans, pulses, food rich in protein, iron, and calcium, and plenty of water as well. Okay. Usually, teenagers suffer from a lot of dehydration, which they themselves are not well aware of. Okay. So, coming to the nutritional requirement, there is a table. Okay. In that table, energy has been mentioned. Around 2,800 calories per day is required for boys, 2,400 for girls between the early years of teenage, 13, 14, 15-year-old. Okay. In the later phases of teenage, more than 3,000 kilocalories per day is required by boys. Okay. And around 2,500 kilocalories are required by girls. Again, it depends on their physical activity levels as well. Okay. So it's a range. The range is broken up into early teenage and late teenage. Okay. Protein, more than 1 gram of protein per kg body weight is required. Okay. At least 45 grams per day uh, for boys, 43 for girls in the initial stage of teenage, 55 for boys in the later phases of teenage, and 46 grams by girls. Okay, in later stage of teenage. At least that much is required. Okay. Fat intake, 35 to 50 gram. Don't go more than 50 gram. Fat intake is also directly proportional to the activity level. If they are more active, more fat intake is required, but not more than 50 grams. The highest fat intake goes up to 50 grams per day, not more than that. Okay. Then minerals, focus more on iron, calcium, iron specifically for girls. Okay, girls are more at the risk of developing anemia because during teenage, usually the menstruation starts. And once the menstruation starts, girls are more at more risk of developing anemia. So girls will require around 0.5 mg of iron on a daily basis. That much iron they are losing. So more than that is required. Zinc deficiency, which is not that common in adolescents, but zinc supplements, it has been shown that it can increase the puberty growth. Okay, in adolescents who are not uh, uh, attaining their puberty. Okay, girls who have turned 15 and still they haven't got their periods yet. Okay, in those situations, zinc supplements can help. Even for boys who have not attained their growth spurt in the initial teenage days, that is 13 to 15 years, zinc supplements can help with the puberty. Vitamins. So skeletal growth still is going on in teenage. Even in teenage, you are still growing in your height. So vitamin D intake is important for the structural and functional growth integrity of the body. At least some time of exposure in sun, minimum sunlight exposure is required in adolescents as well. Vitamin B complex is directly proportional to your calorie intake. The more calories you consume, more vitamin B content should be there in the calories. Folic acid as well. Folic acid deficiency can lead to uh, depression, confusion, cognitive decline, okay, dementia, early signs of dementia and all. So vitamin B12, folic acid is required. Then water. It's always seen that adolescents, teenagers, they don't focus much on drinking their water at the right time. Okay, and that can lead to dehydration, or they usually switch their waters with energy drink or sodas, okay, carbonated water and all. Those are also dehydrating in nature. They have high caffeine, they are dehydrating in nature as well. So, if possible, give teenagers fruit juice without sugar, fresh fruit juice, okay, 100% fruit juice without adding any sugar. That can also quench the thirst. Buttermilk, milk, okay, these things should be encouraged in teenage as well. Coming to the food requirements, nutrition, the macros and micros, we have just seen that. Coming to the food requirements. So, eating pattern changes during teenage. Okay, they spend a lot of time outside with friends, eating junk food. Okay, risk of getting addicted to junk food, making it a daily habit to eat on junk food. These things do get started very early in their life. Okay, a lot of physical, psychosocial pressures, peer pressures affect the eating pattern in children. Usually, adolescent girls. Okay, since when they are attaining their puberty, immediately they will put on weight. Okay, so to prevent that, they will skip eating meals. Okay, if their friends are also doing the same, they will skip breakfast or dinner. Okay, starve themselves. So these kind of situations are very common in adolescents. So eating pattern is guided by what the peers are doing, what the peers are eating. Okay, usually they will skip their breakfast. It's very common, and that will affect their academic progress as well, skipping the breakfast. Benefits of home cooked food, because home cooked food are sugar free, gluten free. Okay, salt intake is very controlled. Fat in the home cooked food is also very controlled. So that could be much more nutritious. Okay, spices and herbs, everything are seasoning and everything is done according to what the family prefers or what the adolescents have been eating since a young age. Okay, it is less expensive, desirable, nutritious. Okay, and it forms healthy eating habits as well. So, as much as possible, encourage the teenager to eat at home with parents. Have at least one meal with the family. Then some general dietary guidelines. Have a well balanced food. What is balanced food? All five food groups should be there in the diet. Okay. Calcium, especially girls, should have enough calcium in their diet, iron in their diet, helps in bone density. None of the meal in the day should be missed. Breakfast, lunch, dinner should be had. And food should be colorful, attractive, should have variety. Don't give the same food, same menu on a daily basis. Empty calorie foods like carbonated beverages, soda, Pepsi, Coke, avoid that. Iron-rich non-vegetarian foods like liver, organ meat, okay, can be included. For vegetarians, green leafy vegetables can be included. At least 100 gram of green leafy vegetables on a daily basis is good. Calorie and protein-rich food should be taken to support growth spurt. During the growth spurt stages, again, children are very hungry. Okay, the regular food that they were eating will not keep up with the hunger. So additional one meal you may have to add through the day. So nutritionally dense food should be chosen for that. Both young boys and young girls should learn basic culinary skills. Okay, that encouragement should come from the family, not just force the girls to learn cooking, but also young boys should also know their way through the kitchen. Okay, limit the junk food. Okay, weekly control the pocket money that you give the child for eating food from outside. Snacks, chips, candies, French fries, carbonated beverages, okay, all these things, limit it in such a way that don't keep these things as a stack or as a snack at home. Okay, pizza nights and all, limit that. And even if the child likes pizza, try to make pizzas at home with homemade flour. Okay, adding more veggies, adding more cheese. These are again a source of protein. Bakery items, bakery products should be avoided. Don't keep these things as snack at home. Coming to nutritional problems that are very prevalent and very common in adolescents, obesity. Again, obese adolescents you will find mostly in South India as compared to North India. Okay, studies have conducted throughout India. It's seen that in South India, obesity is more prevalent among adolescents as compared to North India. So the most important contributing factor for obesity is overconsumption of sweet carbonated beverages, okay, packaged beverages like Maaza, Slice, Coke, Pepsi, Thumbs Up, these things. Consuming too much of high glycemic food that can also cause hormonal disruption, leading to PCOS. Not having enough exercise, not spending time enough out, okay, playing or not participating in any physical extracurricular activity. So these all are the contributing factors towards obesity, and also parents also play a very important role. If parents are promoting these kind of behaviors, okay, not encouraging healthy food choices. Okay, that can also be a issue. Eating disorders are more common in girls as compared to boys. So anorexia nervosa, one of the eating disorder, very common. Uh, there is a movie called To the Bone. I have mentioned in the bracket. You can watch that on Netflix. Okay. So not just anorexia nervosa, but different types of eating disorders common among young people is shown in this movie, To the Bone movie. Okay, watch that movie. You will understand how it is. Okay. So in anorexia nervosa, the girl or usually girls are affected, boys also get affected. They are extremely thin, but they see themselves as somebody who is extremely obese. When you look at the child who has anorexia nervosa, they're very extremely thin, very thin. Okay, but they consider their self perception of themselves is they consider themselves as someone very fat. Okay, so you will see rapid weight loss in them. They don't get periods because they don't have the nutrition for the periods to take place. Okay, their hands and arms, shoulders, body, it has um, a very thick hair. Okay, lanugo kind of a hair. Nausea, vomiting, constipation. These things are very common. Excessive exercising to lose more weight. Already they are very thin, but on top of that, they will try to exercise a lot to lose more weight. They're obsessed about food, but they don't like tasting the food. Okay, they always think about food, but they don't eat food. And they eat in very tiny portions. Then bulimia nervosa, it's a binge eating disorder. Another eating disorder, but usually it happens in late teens or early 20s, not young teenagers. They eat a lot, then they induce vomiting, okay, so that whatever they have eaten comes out, or they will eat a lot of laxative before the food gets absorbed in the body. They want to push the food out of the body, okay, but they eat a lot, and again the cycle repeats. Okay, they have ideal body weight, but usually they have a lot of weight fluctuations. They eat large amount of meal but without gaining weight because they want to induce vomiting and bring whatever they have eaten for the taste sake, they will bring it out of the body. And that affects their oral hygiene as well. Continuous vomiting affects oral hygiene as well. They have malnutrition, menstrual cycle is irregular. This cycle is they will be on a strict diet for a few days, and then one fine day they will forget that diet, eat a lot, then again they will start the crash diet all over again. So this kind of pattern is seen in bulimia nervosa. Then we have binge eating disorder. Here, continuously they will binge eat. Continuously they will keep on eating. There is no stopping. They do not know when to stop. Okay, so because of that, this is called overeating as well. Because of this, they have weight issues. It can start at any age, teenage, early teen, late teen, any age it can start. They're usually overweight and obese. Okay, they do not know when to stop. Once they start eating, they keep on eating, and after they have finished the meal, they feel depressed because of what they have done. Okay, they eat to a point of extreme discomfort until they are completely full. Okay, they will avoid going to any social functions, social events. Okay, because they don't want to eat the food that would be served, because once they start eating, they cannot stop. Okay, so that is binge eating disorder. Then you have female athlete triad, which I will explain in detail. Anemia, undernutrition, premenstrual syndrome. Anemia, we have discussed in detail. We will discuss again in detail. Nutritional anemia in dietetics. Okay. Undernutrition, very common, especially in India. There is a gender bias as well, in which girls don't get enough good nutrition. Whatever is prepared in the home, it's usually given to boys. Okay, very common in majority of Indian households, rural Indian households. Still, it happens not just in terms of nutrition, but also in terms of good education. Okay, some households you must have seen the girls they go to public school, but the boys have the access to study in a private school only. Okay, so yeah, this extends to the nutrition of the young girls as well. So undernutrition is very common in India for young girls. Premenstrual syndrome, if you are not having good diet, if you have major and minor deficiencies in the body, women suffer from PMS, premenstrual syndrome. Okay, everyone, women here, they would know this. Before you get your periods, okay, a certain change in the mood happens. Okay, a change in the diet happens. What kind of food you like, what kind of food you want to eat. Okay, tenderness, breast tenderness, painful breast, heavy breast, swelling in the breast. Okay, these things happen. That is premenstrual syndrome. Okay, for everyone it's different. It's not that every woman will have the same symptoms. Some may have migraines, some may have cramps, abdominal cramps, even before the period starts. Okay, these are premenstrual syndrome. It's a sign that your body is not nutritionally well. You may have some major or minor deficiencies going on. If you do the blood test, you will understand. When you correct all your minor deficiencies, your PMS will also go down. Okay. Then malnutrition, again, that's common. Teenage pregnancies, okay, not giving enough good food to the female child. These things are very common. So that leads to malnutrition. More common in rural India as compared to urban India. And also, already the girls who are suffering from any eating disorder, or already they suffer from malnutrition. Okay. So coming to female athlete triad. So this is a situation. You can see here two triangles. One is green and one is red. Okay. The green triangle is a state of a woman or a teenager who is healthy. Okay. She has optimum energy availability, which means whatever food she is eating, the food is giving her energy. Okay. She is not lethargic. Some women, young girls, if they have insulin resistance, okay, even after they eat food, they don't have the energy. They still feel tired, lethargic, fatigued. Okay, so that's a sign of an insulin resistance. Okay, so here, but in a healthy situation, even if she has a little bit of food, but she is able to obtain energy from that food. Her body is digesting it and utilizing the energy in an optimum level. So there is an optimum energy availability. Okay. Then the bone health, the bone density of this girl is also good. She is not suffering from osteoporosis or bone demineralization, painful joints, and painful osteomalacia. She's not suffering from these bone related health issues. Okay, her bone health is good. And eumenorrhea means normal menstruation. She gets her periods regularly. There is no heavy flow, there is no light flow. Okay, normal healthy periods in every 27 to 35 days. In that cycle, she is getting her periods. Every month she is getting her periods. Okay. And there is no severe issues with the periods. Okay. Some women, even if you're getting periods on a regular basis, but you undergo severe dysmenorrhea, painful periods, or periods are interrupting your daily work or day-to-day activities. That is not healthy. Okay. Period should be part of your monthly schedule. It should not stop you from going to college, going to school, going to work, or participating in your regular household chores. Okay, a healthy period should not stop you from doing that. That is eumenorrhea, healthy periods. So if nutritionally everything is good, a healthy woman, a healthy girl will have all these three pillars. Okay, this triangle, she will be in this triangle. Okay, but as soon as her nutrition drops, even if it is the same female or some other female, okay, but her nutrition drops and she's in marching towards insulin resistance, then she will not be able to get energy from the food, with or without any eating disorders, doesn't matter. Her body, she's eating food, but that is not enough for her body to get energy. Okay. Slowly, subclinical menstrual disorders will start. It may start with few months of missed periods, irregular periods, okay, heavy flow, low flow, heavy pains, severe pain, abdominal cramps, migraines, okay. Slowly, menstrual disorders will start. And slowly, the bone density also goes down. And if still she is not correcting her diet, if the woman still she is not correcting the diet, she will reach this red triangle where there is an eating disorder, may or may not be an eating disorder, but still there is no energy. She could be diabetic. She could have severe insulin resistance. Okay. There is no periods at all. Okay. Earlier, she was having some symptoms of severe symptoms of periods, but now periods have completely stopped. Amenorrhea, no periods at all. Now, osteoporosis, the bone is demineralized. Okay. So this is the female athlete triad. Is it clear to all? So coming to the nutritional programs we have to improve the nutrition of our girls. Okay. The World Bank has the ICDS program, ICDS Integrated Child Development Scheme. Okay. Through Anganwadis, through PHCs, CHCs, okay, even through government sectors, some food ration is given to young girls, young teenagers. Okay, 100 grams of some pulses or food so that their nutritional requirements are met. We are well aware that of the nutritional bias that takes place at rural settings in India. So this 100 grams or 200 grams of pulse mix that is given to the young girls, that will take care of their additional nutrition, even if they're not getting good nutrition at home. Okay, that is some of the plans given by ICDS. Supplemental nutrition programs are given. Then we have this supplementary food of 100 gram, as I mentioned, take home ration. But for this, she has to go to school. Okay, girls have to go to school. Only then they will get this 100 gram per day of take home ration. Okay, so this ensures that girls are attending school. They have attendance, and with that attendance, they get some food to go and prepare at home as well. Then Sabla Yojana, Rajiv Gandhi, it's a Rajiv Gandhi scheme for the education of young girls. Okay, so that's a Sabla Yojana, takes care of the health and education of teenage girls, young girls in rural India. Chennai Corporation, they also have come up with various schemes for 10th and 12th class students, giving them food during their extra classes. Midday meal program, obviously it is there, but apart from that, for the board students are attending boards in 10th and 12th, for their extra classes if they have to stay back. Some food, glucose biscuits or some food is distributed. Okay. So that's all about the nutritional requirement of young girls, young women, children, and adolescents.